Hi, my name is Samantha Jones. I'm a midwife. I have been studying on the Midwifery MSc Master's programme, and I've just finished my second year. I decided to take on extra study. I completed my degree, became a midwife, and then I finished my preceptorship and decided to embark on the Master's programme, really to advance my knowledge from the modules that were included. I decided to do it at Bangor because I had done my degree at Bangor, and they were the only local university that were offering specific Masters in midwifery. I think the best thing about the course is that not only have I been able to take advanced knowledge into my practice, but I've also been able to work alongside other departments and incorporate and build relationships within those departments, and be able to have relationships afterwards, so that I have a better understanding of how they work, they have a better understanding how our department works, and ultimately that has really enhanced patient care, and I've thoroughly enjoyed that aspect of it. I have found balancing work and study. In the very first year, I was based in the hospital, and the long shifts meant that I was having more time off in the day, and I found that a lot easier to actually balance. I have since come out to community, and I work 30 hours, which has been quite demanding. Because community-based work you don't tend to switch off from, and I've really had to be very strict with myself, and sit down and really concentrate on the work that has needed to be done. However, I have managed to do it, and setting that time aside has really helped. Additional to that, it's also given me an opportunity to focus and have some time and space away from the family, also some me time really, in order I enjoy learning, so I've really enjoyed that aspect. As part of my Masters, I have done something called APELing. So I've set up my own business with complementary therapies for maternity patients. And so after I've completed my Masters, I'm going to take a break because I've been studying for a very long time. But I'm not sure whether I'm going to go on to do further study in terms of doing something within the university, or whether I may do some further study with maybe in terms of like breastfeeding, just to enhance practice a bit further. So for the International Women's Day, this year for midwifery is optimising the childbirth experience. And this is something in community that we try and do on a greater level. I was doing the active birth sessions and trying to encourage women to look at the evidence for home birth. Within the Master's programme, I looked at optimising childbirth for women who had caesarean sections, things like skin to skin, breastfeeding support, starting really in theatre and going through that. I think one of the things is to make each and every woman's experience unique to them, tailored to their set of circumstances, and to really embrace what we're able to do for women, and just to help them have a very positive experience that has been totally tailored, and really meets their needs, that of their baby, and that of the people that are supporting them and are around them, so that it just delivers safe care, and an experience that they really will never forget.